Hi guys, welcome back to my channel. Today I'm going to be making the relatively long awaited BBL video where I talk about my BBL experience, what I had to do to prepare, how it is now, how it was shortly after, and then answering some questions that people were asking me on Instagram, and basically just if you are planning to go to where I went in Florida to Dr. De Jesus at Spectrun, I'm just going to walk you through basically all the things I had to do to prepare to when I had to go there, how it was, all that stuff. So basically, I'm just going to jump right into it. I'm wearing right now the Faja Stage 2, I think, or Stage 3, and ab board, so I look kind of like boxy right now, but I am in the Faja, so you can see the board is right here, and this is how I look right now. This is like 7 to 8 weeks post-op. I had it done on November 3rd, so this is how my butt looks now. It's very heart-shaped. It's very like round. My hips are rounder now. My waist is smaller. It's like already 2 inches smaller, and I still have swelling. The ab board kind of doesn't do the justice right now because it's like hard all the way right here, but I love my results. I did have some not complications, but some like little setbacks, and I will explain that. For the most part, it went really well. Okay, so preparing for your BBL at Spectrun, whether it's with Jesus or another doctor, they all have like different protocols and different like screening that they want, but for the most part it is like the same for everyone. So basically you have to get blood work and urine analysis 2 times before going there. The first time is at your 60-day mark, and the second time is at your 30-day mark, and basically they're testing for HIV, pregnancy hormone, your blood levels, like iron, like all the hemoglobin levels. There's like so many things listed on the paperwork, and they're all basically like blood levels, kidney function, stuff like that. So basically like a routine physical kind of blood work, but also with like anything that would complicate a surgery. They also check for nicotine, which is like you're not supposed to have any nicotine in your system before you have surgery. They actually tell you to stop like about a month before. But I don't smoke, so I didn't have that issue, but I know for most people smoking is very hard to quit. But I would just really consider that before getting surgery in Florida. I don't know how other places are, but they're really like, they will cancel you if you have nicotine in your blood. So another thing to know is the blood work will not be covered by your insurance. You will have to pay out of pocket. I definitely think you should go to LabCorp because they work directly with the paperwork that Spectrun sends you, and it won't cost a lot like LabQuest and like other labs, but I think mine was like $450 each time, or maybe $350. I can't remember the exact number, $350 to $450 each time that I had my blood work. I know that Spectrum offers packages now where they will cover your labs for a cheaper price, like half the price, and they will also throw in like the garment, I think like 2 garments, like the post-op massages and stuff like that. So if you are thinking about going to Spectrum, the first question I would ask them is their packages for the blood work and the massages and stuff, because that is going to save you a lot of money and you're going to want it. You're going to need 5 massages at least after anyway, so don't even try to like save money. You're going to need the massages, especially if you don't have drains, which Dr. De Jesus doesn't use drains, so you're going to really need to get all that fluid out, or else you will develop a seroma or a hematoma like I did, which I'll get to that later, but you definitely want to get your massages. So yeah, blood work packages, you're going to need to put down, I think, $500 to secure your date with them. You're going to want to tell them all the extra areas you want. I got my chin added, it was $400. I got my arms added, that was $400. And then I got my armpit area, which was $400. And then already included was my belly, my waist, and my back from this down. And then they put it in my hips and my butt. They're only allowed to take out 4 liters. So know that if you are wanting to add like a lot of areas, make sure that you don't have a lot of fat in your stomach, so you can, like they can lipo everything they need to lipo out of you for you to be happy, because as soon as they hit 4 liters, they won't take any more fat. Okay, so when I got there to Miami, it was kind of hectic to get like the rental car, so I would definitely consider using that app Turo, I think, Turo. It's a it's like an Airbnb for cars, and it's way easier than Ubering or getting a rental car from the airport, because there was just so many complications when I tried to get the rental car. I didn't get to the hotel until like 3 hours after I landed, and they also charge a lot of fees, so definitely look into Turo if you are at least over 25, because they do charge more if you're under 25. That's just a side note. But basically, when I got there, I had the pre-op visit the next day, and I was thinking that I was gonna be in and out, just sign some paperwork. They were gonna take pictures or whatever, and I'll come back for surgery the next day. I was so wrong. And I definitely suggest joining the Facebook groups that they have for Spectrum, and then for your doctor that you choose, because there's so many girls in there that answer your questions, that update you on their journey, so you can see how it is, so you can know what to expect at the visits and everything. But after I joined that group, I heard girls saying that they were in the pre-op appointment for like 3 hours. I was like, what? But they were not lying. Literally, you go, and it's like, you go to the second floor, you enter from the garage, and somebody signs you in. You go to the second floor. They ask you your name, and they say, okay, have a seat. You're sitting there waiting. There's probably like 8 other girls in there signing paperwork also. And you're waiting and waiting just for them to prepare the paperwork, so you haven't even got to sign anything yet. And this part took like an hour just to wait for them to give me that big, thick packet of papers. And they finally called me, and they're like, here, sign everything. Don't worry if you miss anything, because I'll go over it with you when you get back. And I signed everything. I was like, I'm done. And they're like, okay, well, we'll call you in a few minutes. About half an hour goes by. It took me like a half an hour to sign everything, because it's just like initialing. Like, you sign like, I think, your actual name like on 10 pages. And it's all about like agreeing to the surgery, the downfalls that might be able, all of the negative things that could possibly happen, all that stuff. So it is a lot of paperwork, literally like 300 pages. And they went over everything with me, and then they told me to go to finance, finish paying it off. I paid it off. They gave me a receipt. Then I waited for the nurse to call me back for pictures. So I get in this gown, she takes pictures of me, weighs me, everything to make sure I'm under the BMI, which Dr. Jesus's BMI is 32. You can't be over 32, or else you will not be able to have surgery. It's a health factor, but it's also a good idea if you want really good results, because they are only allowed to take 4 liters of fat out. And the more fat you have, the harder it is for your skin to snap back. So, which is also why I got J Plasma, which helps tighten the skin. So I was like, I think 30 something, almost 31. So I was like right before the cutoff. And so they're like, okay, cool. You're gonna go downstairs, and they're gonna give you the instructions for what to do tomorrow for your surgery. Okay, so I go downstairs. The lady was like, oh, well, we don't have the time yet, because we go like day to day based on how many clients she has, patients, and anything that happens within those surgeries. So I was like, okay, whatever. I waited. They closed at like 5 or 6. It was 7 at this point, so I was like, did they forget? I was worried. I was like, I don't know what time to go there tomorrow. I'm not even sure if I know the right clinic, because there's 2 clinics. There's the main Spectrum clinic and then iBody. and only some surgeons perform at Spectrum's actual clinic, so I had to go to iBody first. I was freaking out. I called, nobody answered. I missed a call, and so I tried to call back, nobody answers. They finally called me again, and they're like, oh, okay, so you're gonna go to iBody. You have to get there at 5 in the morning, so don't drink any water. 11 hours, I believe it is. Yeah, 11 hours prior. Don't drink anything. You can't even have water. So I was like, okay, cool. I don't drink. I don't eat. 5 o'clock the next day comes around. I go to iBody. This is where I messed up because I peed in the morning before I left, and they didn't tell me, like, you're going to have to pee when you get there, which I kind of knew I was going to have to pee for the drug testing, but they just didn't tell me, like, hold your pee, basically. So I was like, I can pee. It'll be fine. So I go there. The nurse called me back after waiting another 3 hours. Literally, I didn't get called back for, like, 2.5, 3 hours the next day for a surgery day. And there's hella girls in there in a robe waiting for their surgeon. This is, like, the worst part is waiting because they really have you wait, like, and it's really bad. Like, it's literally like a butt factory almost, because I know when you go to Mexico, like Tijuana, for surgery, they actually do everything like the same day, the blood work. They don't make you do screenings like months before. They just say, okay, your surgery is this day, we're gonna test you on this day, and if all this stuff is good, then you just have surgery hours later, and then they keep you for at least 24 hours after, which everything was opposite in Florida. I go in. I couldn't pee. The lady was like, well, if you can't pee, you know, somebody's going to have to go before you for surgery, and you're going to have to wait here longer, which is going to be like 3 more hours. So I was like, no, I can pee, which I should have put my fist in the hot water to simulate, you know, to my body to pee. But I didn't think about that. So I was just trying to push really, really hard. I couldn't get any pee out of me. I was so stressed out. Like, she only needed a little bit, and I couldn't even pee a little bit. And basically it's like a cup with all like the drugs, like nicotine, alcohol, coke, like everything, like just lined. And the pee like rapid tests and will show if it's like positive or negative. So keep that in mind. They are gonna check all those things. And, you know, it doesn't take a while for your body to get rid of most things, but just keep in mind that they are going to test. And if it's even positive for one thing, you can't have surgery. So I finally was able to pee. I couldn't even drink water or anything because I had nothing in my system for like 12 hours, 13 hours at this point. And I asked her, can I just drink a little bit of water? And she was like, no, if you drink anything, like, you're going to have to wait longer to have surgery also. So you're going to have to just try and do it. I was like, okay. So I finally get pee out. My tests come back fine. I wait in there like another hour, maybe almost an hour, like half an hour. And then Dr. Jesus comes in, marks me up. She's super sweet, super honest with everything, her techniques. You're allowed to ask her what you want to look like, how you can show her pictures, and she'll tell you straight up, like, I don't know if I'm going to be able to do that in one time, or this person probably has implants, so you're not going to be able to achieve that. She'll tell you straight up, like, everything. And so she marks me up everywhere. I'm in the gown still. I'm waiting, like, probably 10 minutes after she's done. And then the anesthesiologist comes in. He's like, are you ready? I was like, I guess so. After she explained to me that I could possibly die and all those things, I was like, okay, I guess I'm going. They roll me in to this cold, metally, small room. Like, I thought it was going to be like a hospital room. I was expecting, like, I don't know, a room like I gave birth in. I was so wrong. It is like a small metal table. They strap your arms down like this. They put the IV in, and it's freezing in there. It's just a bunch of metal objects, a bunch of, like, surgery objects. It's, like, really scary. I was getting anxiety at this point. He tells me, you're going to taste something funny. I tasted something funny, and the last thing I knew, I was out, and I woke up in a freezing cold room on my stomach. I never felt worse in my entire life. I've been hungover. I've been sick with a 103 fever. I have been hospitalized for asthma. This was the worst I've ever felt in my life, even after giving birth. Nothing topped how I felt after the surgery when I woke up. I felt stiff. I felt tired. I felt out of it. I felt pain, like, oh my god, like just pain everywhere, right here in my waist, in my arms. I couldn't even lift up because they lipoed my arms, so it hurt so bad. I couldn't move. I felt like I was gonna throw up. Another thing is I have asthma, so I literally felt like I couldn't breathe. I was like gasping for air, and they have the air tube in you when you're doing surgery, which dries out your throat more. So I was literally like dying when I woke up. I was like, I can't breathe. I can't breathe. I don't have my inhaler. And the nurse opened like a brand new inhaler box and like gave it to me. And I was like, I didn't even know they had inhalers on standby like that. But thank God they did, because I literally thought I was gonna go in freaking shock or something and pass out. So after she gives me the inhaler, I'm like, please, can I have water? Like, I'm so thirsty. My mouth is dry. I'm gonna die. I will like pay you $100. Just give me water. I literally told her that, and I was so serious. Like, I never wanted water so bad in my life. And she's like, I'm sorry, you have to wait. Like, I can't give you water right now because you're still really nauseous. Which I was. I was like, can you give me a pan? Because I feel like I'm gonna throw up. So she gave me a pan, and I was like sticking fingers in my throat because I thought like if I threw up, I would feel a little bit better. And I was so dizzy and nauseous, I couldn't throw up. Like 10 minutes after I woke up, they were like, okay, your ride's outside. You have to go. Mind you, Mexico does like probably the same price as Florida. Their medicine is covered with like an extra $100. Their 24-hour stays included. They'll keep you, give you fluids, give you all the medicine you need. Florida, you wake up, they kick you out. Literally, they put you in a wheelchair and they're like, here you go. Literally, like, it's so bad. When she put me in the wheelchair, I fainted. I was like, I don't feel good. And I was like dizzy, and I just like threw my head back and I was out. And then I didn't wake up. She didn't even care. Like, she pushed me out into the parking lot, still like didn't wait for me to wake up. She pushed me out and she's like, it's okay, baby, it's okay, like, you're gonna be fine, this is the worst day. And my friend that was with me was there, and so she had everything set up in the car, and I was like, I can't, like, I'm dying, I can't even see, I'm so dizzy, like, I want to throw up, I want to drink water, like, I can't. And so I get in the car, like, in pain, dizzy, like, literally I feel like I'm in a dream or something. And I was like, please, can you take me to McDonald's? I just want like a smoothie or something that I can just like chug. And so she takes me there. And I'm so out of it. Like, I just can't even like grasp reality almost. I go back to the hotel and I was like, I need to take a bath, which you're not even supposed to be in water for like the first week at all. Like, you can shower, I think, after a few days, but you're not supposed to be submerged in water at all for like a week or so. I was like, no, I just need to be in the bath because I feel so dirty. There was blood everywhere. My whole faja was sticky, crusty, and blood. I took it off, and you're not even supposed to take it off for literally like the first 2 to 3 days at all. So I go in the tub, and I try to get out after a few minutes, and I'm like looking at my stomach, and I'm like, oh my god, my skin looks so weird. Did she not do J-plasma? Why is my skin like that? Which, obviously, you just had lipo, so your skin's literally detached from the muscle. I still can't even feel my skin, like, when I itch it. But that's besides the point. It takes a while to snap back, is what I'm trying to say. But I was freaking out about that. So I try to get up out of the bathtub, and my friend's there with me. And she's like, hey, get up really slow. I was like, okay. So I get up, and I was like, I don't feel good. And then I fainted in her arms. This is the first time I fainted on her. And I woke up and I see her like looking at me, and I'm like, did I fall asleep? And she was like, you fainted. And I was like, fuck, like, I'm really fucked up right now. I was like, okay, let me try to get up again. I get up again, and I fainted again near the toilet, and she caught me again. And I woke up. I was like, I just need to lay down. So when I did wake up the second time after fainting, I was probably out for like 5 minutes each time. It wasn't like super scary. I mean, it was scary, but it wasn't like I'm fucking dying. So she lays me on the bed and I pass out naked. Like, I didn't even have my faja on, and that's really bad. Like, I should have had compression on. That's probably why I got a seroma. But so I go on the bed, and when I wake up, she's like, you need to put your faja on. So I put it on. That was the most painful experience of my life besides the waking up. It was like, I can feel like every part that got lipoed, like, in immense pain. Like, I was getting stabbed everywhere, and it was just like so tight. I felt like my skin was gonna rip off or something. And it was just, it's like you have to zip it up on the side. So I felt like I was cutting myself or something with just the zipper. I was in so much pain, and like they have you on antibiotics, nausea medicine, oxys, Percocet. Like, I was on a lot of stuff, and the oxys also make you more nauseous and make you more out of it. So I really didn't want to take them. I didn't like them, but you know, I had to take them because I was in so much pain. And you're sleeping on your stomach. So on top of that, I was having huge headaches every time I would lay down because my neck is like in a weird position. I'm laying on where I just got lipoed, and I'm taking oxys, which also makes you more prone to headaches, which a lot of people don't know that because they're for your body pain. They're not for like headaches and stuff. So they actually increase your headaches. They will give you headaches. So, and also when you're after surgery, you lose a lot of blood. Like, everybody loses blood in surgery. They're literally sucking it out of you. So that also makes it more likely for you to get headaches, especially when you're laying down on your stomach with your neck all twisted. So literally I had a headache for like the first 2 weeks. All the time I had a headache. I was like, oh my God, I'm never gonna get over this. I thought I would be walking around by now. Literally, I was there for 5 days after surgery, and I could barely function at all. Like, I saw some girls were walking around like nothing. When I would go to my post-op massages, which hurt so bad, I was like, I can't even walk without holding onto the walls like next to me. I have to smell like an alcohol pad just to not feel nauseous. When I was getting the massages, like, everything they touched, literally, I felt like my heart was beating really fast. I was getting like lightheaded, and I was in so much pain. I was literally crying. Like, the massage people probably thought I was so annoying. You can literally feel like a curling when they're massaging your waist because they push everything to the front and down to drip out of the holes. And it is the most painful thing. You really need to get the massages, but it was the most painful thing. I took like 2 Percocets and 1 Xanax before I went in, and I can still feel everything. Like, oh my God, I thought it's worse than childbirth. It's worse. I mean, at least to me, it was worse than anything I've ever been through, like that massage pain. And you can just see all the blood dripping out, and you can feel all the fluid like moving. Like, even when you push everything like by yourself, you can feel like the fluid all in there. So you know you have to get it, like, you have to get it out. But it's really painful, and it's like an hour-long massage. So that's another thing to keep in mind. That's the hardest part, is doing the massages after surgery, because you're gonna be like nauseous. You're gonna be dizzy, you're gonna be sore, you're gonna be really vulnerable, and just like pushing everything, it's like the worst thing ever in that state that you're already in. So I get back to flash forward after that, after going to the airport to go back home, the longest flight of my life. I had to literally like sit on my BBL pillow on the flight, which is really important. You need the BBL pillow. You're not supposed to sit on your butt at all for like the first 2 weeks. I was like lifting, I was like holding myself up on the plane. Like, it was the most uncomfortable thing. It was like a 5 to 6 hour flight, and I kept like going down. So I was squatting or kneeling on the chair and like laying down on the airplane chair. And, you know, I had to sit up sometimes because when they turn the seatbelt sign on, you have to be in your seat. So I kept switching back and forth between kneeling on the seat to sitting on the seat. I would fall asleep and my knees would fall asleep. So I would like be in a lot of pain trying to sit back up. and it was just like hell. And I had a freaking stop in Texas, I think, so I had to get out and walk and find my next plane. And I wasn't even sitting next to my friend on the second ride, so it was like so chaotic for me. If you are gonna fly to Florida, I would definitely try to get a straight through flight, which I did at first, but they had to switch it because of Corona. So yeah, keep that in mind. You're gonna really want to have a straight through flight because you don't want to get up and deal with all that stress. You just want to get home at that point. So after I get home, I settle in, you know, everything. I still feel dizzy. I still feel tired when I walk around, like my heart's beating really fast and I just can't function at all. I was scared. I didn't know when I was going to go back to normal, still getting bad headaches. I just felt useless, and I was crying a lot because I was scared to be alone. I was scared, like, I didn't know when I can go back to work. I was just really stressed out, and that's another thing to keep in mind is, like, you're going to have to, like, be out of work for probably 2 to 3 weeks, depending on what your job is, and it's going to be stressful because you're not going to know when your body's going to feel better again. So I think the second day that I'm back, I hired a local massage therapist to come to me because I couldn't even drive because I was so dizzy still. And she came and she was like, "You look really pale. Like, are you okay?" And I was like, I think I lost too much blood. I did ask my surgeon, and she's like, "Well, you probably need a blood transfusion, so you should go to the emergency room." I was like, "Okay, well, I'm gonna wait it out and see if I feel better." I never felt better after the massage. I felt like more dizzy because she was massaging all the fluid and everything. And so I was like, you know what? I'm going to just go to the emergency room. I go to the emergency room. They test me. They test my blood levels and everything. My iron levels dropped from 14 before surgery to 7. And when you're under 9, that's like danger. Like, not danger, but like, you're not supposed to go under 9. You're like anemic at that point where you need a blood transfusion. So they transfused me with 2 pints of blood and fluid so my body could like regenerate faster. I was in the hospital for like 5 hours. That the blood transfusion's kind of slow. So I was there for like a long time. I fell asleep there. I had my pillow, so I was like lifting my butt up, but eventually I was able to go home. My blood levels went back to normal. Relatively, like they're gonna build up over the days, but like they went over the safe zone at least. So I go home. They're like, okay, take iron supplements for like until your body feels good again, which I'm still taking them, and it's like 8 weeks post-op at this point. Really important to take iron, by the way. So I eventually felt better. I think by week 3 I felt better. My doctor told me to keep my faja on 24 hours a day for at least 6 weeks, and then you can go to 12 hours a day, which I am going to be honest with you, I did not keep it on 24 hours a day. I would wear like this stomach binder because the faja, I just felt like it was squeezing my butt and my hips too much, and I didn't want to like risk losing the fat transplant. So I would just wear an ab board with like a binder, like waist trainer kind of thing, which you're not supposed to wear corsets or super tight clothing because it can cause your skin to like lose circulation of blood trying to reform itself back to the muscle, and it can die. It can like be catastrophic for your skin, and you can also create fibrosis, which is like those little bumps in your skin that you see after lipo, which can be fixed with wearing a board underneath your faja, because the wrinkly stuff from clothes is going to be what's going to cause fibrosis because your skin is so tangible at that time. So always make sure to wear your board, and always make sure to get at least 1 to 2 massages a week until like 3 months. You're going to want to get regular massages. Also, to prevent fibrosis, I got this ab roller from Spectrun. It was like $20, $25, and you just like roll from the top to the bottom, like kind of hard, like you want to like feel like you're actually massaging the fluid, and it will make your skin noticeably flatter if you feel like you see scar tissue or fibrosis forming. I do it on my sides right here. I do it on my back where there's fluid retention, which, by the way, you're going to notice wrinkles in your back or like those folds after lipo, even more so before you got lipo probably, because your skin is detached. So when you fold back or when you like move backwards or something, like you'll get like 2 or 3 folds because your skin is not attached to your muscle yet. So just keep that in mind. Also, don't be alarmed. It's normal, and it will eventually attach back to the muscle, like over 3 to 6 months, depending on your body. So yeah, this is really important. I do it like twice a day, in the morning and then at night, before or after I shower. So let's talk about essentials that you need when you get surgery. Massages, at least 5 every day after surgery. Urinal, which is like a plastic thing that you stick into your faja, because your faja is an opening where your vagina is, and you can stand up when you pee, because when you sit down too much, it's gonna hurt. And I mean, you're gonna want to drink a lot of fluids, or you're gonna be peeing a lot. So get a urinal. They're like $5 on Amazon. You stick it in, you just stand over the toilet. It's kind of awkward. But yeah, I think I only used it for a week, and then I just kind of like started sitting forward on the toilet and like squatting, hovering over it once I got strength. So I didn't really use it for more than a week. But those puppy pads, like those pee-pee pads that dogs get when they're puppies and when they're getting potty trained, those things absorb a lot of blood. And if you're staying at a hotel or Airbnb, I would definitely suggest bringing your own like disposable blankets, because you're gonna get a lot of blood everywhere. And I had to put like hella puppy pads on the bed because I was moving around a lot. I had gauze, so I switched out my gauze a lot on the incisions, because for the first week you're gonna be draining a lot of physical fluid, like out. After the first week you'll drain it like through your pee after the lymphatic massages, but the first week you're gonna actually be bleeding out like the fluid, not really internally bleeding, but you're gonna be draining the fluid. So definitely get puppy pads, get sanitized wipes, because when you're flying, you're going to want to have everything clean. You're going to want to be able to wipe off blood when you need to. I keep them in my purse. I kept them by my bed table in the hotel. I used it because I got blood everywhere. So you're going to really want sanitized wipes, puppy pads, urinal, your BBL pillow, at least 2 stage 1 compression garments, which Spectrun already supplied me with 2. I would ask them for your current size and then 1 size smaller, so because you're gonna lose a lot of fluid retention the first week, and you're gonna want to have a smaller one right away. You don't want to wait for the next one, because you need that. You're gonna want to buy those little alcohol pads, because when you're nauseous, if you smell them, I don't know, for some reason it takes away the nausea, dizziness feeling. You're gonna also want them for when you inject yourself with the anti-clotting shots, which I think they give you 7. You're supposed to take one every day, and it's in your legs. It doesn't hurt, but just keep that in mind. They're going to give you those shots. Also have a lot of easy snacks, because you're not going to have really an appetite, but you're going to need to eat. You're going to be constipated because of the oxys and like the uneasy feeling when you have to sit down, so keep that in mind. I got enemas, easy snacks, glycerin deposits to help myself go to the bathroom. I got a lot of Pedialyte, a lot of water, because you're going to want to be drinking fluids all the time, like at least like 6 to 8 water bottles worth of fluid, because that's going to help you drain fluid as well from when you're healing. I would also consider investing in an IV where they come to your apartment or wherever you're at, hotel. It's like, mine was $200, and it was a recovery IV, so it has fluids and vitamins in it, and it goes intravenously. And it took me like 30 minutes because I was so in need of the nutrients that my body just like took it all really fast. But I would definitely invest in one of those when you're there. It'll make you feel a lot better, especially if you're having a hard time drinking enough water. Also, you're going to want to have arnica tea, arnica tablets, and arnica gel. That's going to help you with the bruising and the healing process. It's going to help you because you're going to have a lot of bruises in your tummy and your butt and your everywhere that you got lipo or cannula. I don't know how to say it. But wherever they put that inside you, you're going to have bruising. So take that. It's going to help with soreness and bruising. I drank 2 cups of arnica tea a day. I should have probably drank more. I took the tablet like 3 times a day, and then I put the gel on any hard bruises, and my bruises went away within like 2 weeks, I think. So now let me answer the questions that people were asking me. The first question, how was the post-op appointment? So my post-op appointment, the next day I went to iBody again, and I just met with a nurse that I saw the first time before I went in for surgery. And they take pictures, they ask you how you're feeling. They don't really do too much. They don't do blood work or anything like that. And they don't really answer any questions because you're just seeing the nurse that day. The following day after that, you see your surgeon, and that's when they can answer any of your concerns or questions. That's when they'll tell you how your body is looking, what to expect. Basically, they're just making sure you're okay, and they will follow up with you via email a week or 2 weeks after, up until like, I think 3 months. They'll check in with you every now and then to see how you're doing. I let my person that was checking in on me know that I had a seroma. So circling back to that, I had a seroma, which is like a buildup of fluid. I'll put a picture somewhere so you can see what that looked like. But I had to get it drained manually for like 3 weeks probably. I went every day to my friend who's also a nurse, so she took it all out. I'll also put a picture of the syringes and how much fluid I had taken out. So basically, when you're getting it drained, you're going to want to be compressed, very compressed, as often as you can. Only take off your garment to shower, because if you have room, the fluid will build up more. And it's basically building up because your body can't absorb it fast enough, and because you have an empty space, like a lot of empty space. So for mine, it was an active hematoma, which means like there's still bleeding occurring, which doesn't mean you're like punctured anything or anything like that. But it's just like there's still bleeding taking place because your body's trying to heal the skin back to the muscle. So I would do the massages, compress, and then I actually purchased my own syringes on Amazon for like $20, and I got like 50 needles and syringes. And I would do it myself, which I wouldn't do it. It didn't hurt because my skin is numb at this point. I used also like the freeze can, which I'll also link it in the bio. But I just sprayed it, wiped it really clean with alcohol, like all the way until I saw nothing on the pad anymore, to make sure it's sterile, because you don't want to risk an infection. I drained it. I would syringe it and keep syringing it out. Like it's attached, the needle's attached to the syringe, so you can like pull off the syringe and like dump it out and put it back, suck it, dump it out. So the needle's like this long, and so I had to go deep down. You want to go slow because you don't want to hit anything. That's why I'm saying I wouldn't suggest it, but it is expensive to go to a doctor and get it drained every day. So I just decided to do it myself. And you know, I can see how my friend was doing it, and you like kind of push all the fluid and go slow with the needle, and just it'll suck out really fast if there's free fluid there. So you know, you'll notice it'll go flat after. So it really worked out for me. I don't have it anymore, thank God. But that was my only setback, I guess, besides the blood transfusion. Everything else is really good so far. So how long is the recovery? The recovery takes about 3 to 6 months depending on your body. You're not going to want to sit on your butt for at least 4 weeks without direct pressure. I'm still not sitting on my butt. I still use the BBL pillow, but my fat's probably settled by this time. I just don't like feeling like I have pressure there, because your skin is still very sensitive, and like even when I wear underwear, like the mark will stay on me for a long time, and it scares me. So I still avoid sitting on my butt and laying on my butt. I still lay on my stomach. I'm still sore, and it's 8 weeks post-op. I can still feel like fluid retention in my waist, so I have to get massaged, and I use the roller like I said, because I'm still swollen. Not as swollen as before, but still swollen. Like you can see, it's kind of like bloating, and it's kind of like, I don't know, like a poofy looking look on your waist. But when the swelling does go down over the next few months, your waist is going to look way more snatched. So just keep that in mind. If you do get surgery, get compression garments, massages, and just know it's going to take time for your body to snap back. How was the research process? So I researched for like 2 years. Like, I did want to go to Mexico, but I didn't have my passport yet. So I was like, let me just go to Florida. It'll be simpler. I did end up getting my passport on time, which I wish I just went to Tijuana, which I'm going to go for my next surgery anyways. But anyways, I researched every doctor. I researched their deaths, which my doctor didn't have any. I watched a bunch of YouTube videos about people's experiences. I looked at a bunch of before and after pictures. I researched their process that they go through before they book you and before they take you for surgery. So like how payment goes, how blood work goes. I researched all that, and it took me literally 2 years before I was like, okay, I'm gonna put a deposit down for this doctor. Anything else besides a BBL? Well, I did get my chin and my arms and armpit added. Pain scale, like the first day, out of 1 to 10, an 11 for sure. Now it's like at a 2 or 3. It's more like a sore feeling when you wake up, and you can kind of just feel like your body healing. I don't know how to explain it. But it doesn't really hurt too bad after the first 2 weeks. You kind of go back to, kind of not normal, but like you can manage everything. But the first few days or first week, it is going to hurt a lot. And you're going to feel really nauseous and really dizzy. So just know that that's going to affect everybody more or less. But it is going to affect you regardless. Natural or big? So I told her I wanted to be as dramatic as possible. I told her I want my waist to be as small as you can do it. I want my hips to be as big as you can do it. And my butt to be as big and round as you can do it. Like a heart shape and just all around full. I already kind of had like a good shape, but I just needed like a few tweaking. So I already was like a good model for it, I guess. She just filled out my hips a little bit, filled out my butt so it's more plump and round, and like, you know, it's more than before, of course. My thighs are huge though, so you can't really see like a crease or anything where my butt and thighs touch, but I'm gonna be getting a under thigh lipo in that area, so my butt will be able to do that eventually. But that's a story for a different day. How many cc's? So I had 4,000 taken out, 4 liters. I had 1020 put in on each side, so 1020 here, 1020 here, distributed throughout my hips and my butt. My weight at that time was 167, and I'm 5'2", so my BMI was like 5. So my BMI was like, how I said, like 31. The best BMI is like, I would think like 29 to 30 is a good BMI for a BBL, because you want them to really suck out everything so you can get the most value for your money, because they do have a limit. And you're not going to want to have too much fat to where your skin's going to have looseness, you know? Finance options. Okay, so they do have finance options with Care Credit, and I think another credit for healthcare. I don't remember what it's called. I do have Care Credit, which I used it for my J Plasma because I added it last minute, and I added the armpit area last minute, so I used it for that. They do charge an extra $200, I think, to use that. And I really don't think you should use a finance option like that, because the interest rate is like 20 to 30% and it builds up really fast. I would pay it off in cash if you could. My surgery was like after everything, like the COVID test, because they make you get an antibody test when you go there with a needle prick, which I don't understand why, because they make you get a PCR test 7 days before, which shows if you actively have corona. Which I didn't, and then the antibody test also showed negative, but I'm like, if I was to have antibodies, like, would you send me home? And they're like, no, if your PCR test is negative, it's okay. So I was like, we should just use the PCR test, but whatever. Anyways, I didn't really get into that. I was just like, whatever. It was $100 to do the test there. So all in all, it was $6,000 after everything. I paid like the $5,000 in cash on my debit card, and then the rest on my Care Credit card, because I had last minute added a few things. But yeah, that's basically it. All I'm gonna say is, if you do get surgery, research your doctor, prepare, watch videos like this one so you know what to bring. Understand it's a process. You're not gonna look snatched right away. Understand you're gonna go through a lot of emotional roller coasters with your body And especially when your skin is snapping back, it's all normal and it's all worth the process. Like, your swelling's gonna go down. You're gonna think you lost some of the volume, which is also why I recommend measuring yourself every day so you can know what's your measurements and not like your mind playing tricks on you. When the swelling does go down and some of the fat gets lost from like natural reabsorption by your body, there's going to be a fluffing stage where you eat and your fat that you get from eating will accumulate where you got transplanted fat, because naturally fat wants to build where there's a lot of fat cells. So just know that over that time, you're going to lose some weight from when the body reabsorbs the fat, but you're going to gain it in the right areas. So trust the process, research, prepare. I don't want to make this video too long, so I'm going to stop it there. Thank you guys so much for watching, and I hope it was helpful. Bye.